The Council for Medical Schemes is conducting a survey amongst medical schemes members on COVID-19 vaccines. The objective of the survey is to measure support for the vaccinations. Joining us is General Manager at the Council for Medical Schemes, Mr. Michael Willie. Michael, thank you so much for your time. Perhaps let's hear it in your own words. What is the objective of the survey?
Good evening, Unati, and thank you for the opportunity to join you. The objective of the survey really is to gauge support of vaccination from members of medical schemes. Obviously, we want to be able to identify areas where there's potentially going to be a low uptake of the vaccination of COVID-19 vaccine.
All right, I actually think that the timing of this interview couldn't be more perfect because I actually received one of those messages from my very own medical aid scheme. And one of the questions that is on the survey is, do you think it's appropriate for medical schemes to cross-subsidize non-members for the COVID-19 vaccine? What exactly is that question implying?
All right, so in terms of the funding model that is envisaged for COVID-19, currently there's a proposal on the table which is looking at your SEPs, which is the single exit price. This is the maximum level of amount that could be charged for medicines. So the thinking here is that through a social solidarity principle, we want to get a sense in terms of whether private members of medical schemes are almost like willing to subsidize those who are currently not covered. Because if you think about it, through the social solidarity principle, this is like a principle of collective action, which is precisely looking at shared values. Because what we're looking at when we look at COVID, it affects both the private sector and the public sector equally. So it's almost a proposal that we have in place currently to see if whether through this mechanism of SEPs, obviously there are legalities that we're currently looking at so that we ensure that whatever we do in that space is within the confines of the Medical Schemes Act. So what we're thinking there is looking at almost like a funding vehicle where is it possible then for the private sector to almost cross-subsidize those who are currently not covered, so that at least there's some form of contribution that we see from the private sector. So it's almost like a contribution that we see from the private sector to ensure that even those who currently not have cover do have access to the vaccine.
I want to ask you to unpack that a little bit for us, because, I mean, we know that as South Africans, most of us are getting these vaccines for free at no cost. So when you say subsidize, are you saying that you are essentially trying to gauge to what extent private sector, clients for these medical aids and medical schemes would subsidize for somebody else who would be getting this vaccine? So then what then are the effects of people who have medical aids? Does that mean they now have to pay a little bit more for their own vaccinations or pay for somebody else to get vaccinated? Just unpack what it means exactly when you say subsidize.
Yeah, so in terms of funding, in fact, for a member of a medical scheme, there will not be a cost at the point of service. This is precisely because COVID-19, as well as the vaccine, has been declared as a PMB. So basically what it means therefore that is that if you're a member of a medical scheme, when you go to a cost of care, you will not be paying that. And a medical scheme is supposed to pay for vaccination and COVID-19 in full. So for you as a member of a medical scheme, at this point in time, we do not envisage you to pay anything from your own pocket. It will be covered by a medical scheme in full. But then the mechanism that you are looking at is just really a contribution from the medical or the private sector really to ensure that at least, like I indicated, that here, we are basically talking about this social solidarity principle to ensure that all of us contribute, and then all of us, those who are able to afford, at least to a certain extent, do assist those who cannot afford. But for you as an ordinary member of a medical scheme, there will not be an additional cost because your medical scheme is going to cover it in full.
As you know, that the country has already obviously started with the inoculations across the board. We've seen those start in earnest last week. How will this survey that you are currently conducting, how will that impact the vaccine rollout from the medical aids?
I think it's very important purely on two levels. The first level here is the issue around the communication. That is the first one. Then maybe the first one is the communication. And then second one, it is the planning is the first one. The second one is communication. So through this study, you will be able to get, in terms of for instance, the preference for the vaccine. In the survey, there is a question that is talking about which of the 5 levels of vaccines are you likely going to take. So that's at least it gives us an indicative idea or some key insights in terms of the preference of the vaccine that will be available. And then secondly, is looking at areas, like I indicated, potential gaps, because what you see, some of the attributes that we have in the survey is the age bands, for instance, the setting where the member is. The other very key attribute that we have on the survey, it is really the point of access of the survey itself, because we've got 5 categories there. One of the categories is, as a member of medical schemes, where would you prefer to get vaccinated, for instance? Do you prefer to get vaccinated at your GP, who's in most of the cases at your close proximity to where the member resides, or do you prefer to get your vaccination at your local clinic or a pharmacy setting? So it's very important, at least to be able to give some key insights to medical schemes in terms of planning, and they'll be able to get a sense where most people are likely going to get vaccinated. I think, again, it brings about a lot of important elements in terms of strategies that medical schemes can employ in as far as the perception as well as the acceptance of the vaccine is concerned. Maybe just to add on that as well, we've got about 3 levels in the main that we're looking at in the service that we also want to investigate. The first one is really the trust about the vaccine, looking at if some of the beneficiaries are saying that they will not get the vaccination, what are some of those key attributes? So we'll do some form of sentiment analysis and almost like a gap analysis where we're able to identify what are the potential gaps, the areas that need improvement in as far as communication as well as planning is concerned.
Now, I've got another question for you, but before I get there, let's probably just piggyback on what you've just said now in terms of some of the questions that you are asking. Now, to what extent will you use this information, to vaccinate according to what people want? I mean, the question that you mentioned is that here it says, which vaccines do you prefer? And AstraZeneca, as you know, from the University of Oxford vaccine, was the one that was supposed to be the one that we were using in South Africa. But I see that it does form part of your survey where you're asking for Pfizer, BioNTech vaccine, AstraZeneca, Johnson & Johnson, and Moderna. To what extent do your medical scheme members have liberty to choose?
Yeah, you see, at this point in time, that's a valid question, but at this point in time, it's very difficult to answer it. But at least the survey will be able to give us insight in terms of the awareness and in terms of the range of vaccination products that are available in the market. And the other thing that is very key here with regards to the vaccine itself, it is the awareness around not just the products themselves, but the awareness around the process to get vaccinated, because we have what we call the EVDS, which is the electronic vaccine data system. That is, it's a self-enrollment system where people will go and then register and they'll get some information on how they'll be able to get the vaccination. So at this point, we're trying to measure the awareness as to what extent people understand the vaccines, as well as the range of vaccines that are available that will be made available to members of medical schemes. And then the other element is like the process itself, are people aware? So at this point in time, I can't say, but maybe at least the survey will be able to give us maybe the insights in as far as the awareness is concerned. And at least those results will be able to use to even communicate further, look at communication drives, initiatives that could be employed at scheme level, so that at least you enhance, you sensitize members and then also enhance the awareness of some of these vaccines.
Now, let's talk about timelines very quickly. When are you expecting to get the results from the survey? And what is likely to happen after the survey and after the results that you've gotten? I mean, as you know, we are vaccinating in stages and in phases in terms of hierarchy. When are you expecting to then implement just some of the feedback that you are getting from this survey?
All right, thank you. I must indicate, I think the survey is going very well, more than we expected, because at this point in time, when I looked at the numbers this afternoon, we had over 45,000 respondents. So it's an overwhelming response that we have received from members of medical schemes. But we obviously want to encourage, but what we see lacking is the participation from the public sector, because you do have a number of schemes, particularly members who are in the public space, they have not responded to the survey as we expected them. But overall, we have over 45,000 responses. I think we can get a lot of information, insights in that, in the work that we have done. And we plan to close the survey sometime next week. And our prediction is that maybe by end of next week, Friday, we'll have over 50,000 respondents, and then we'll start with the analysis. We are looking at having maybe the first draft of the report 1st of March. And I think the findings of this report will be very, very important, because what it does, it will give you the level of acceptance at scheme level. So each of the medical schemes will be able to get a sense in terms of the as to what extent are their members willing to accept the vaccination. So it's very important. It will assist the medical schemes in terms of planning as well as their communication strategies. But again, it's going to assist the government and policymakers in terms of the centers that people prefer to get vaccinated at.
All right. Now, we know that there's been a lot of skepticism both from the medical aid private members front as well as the public front in terms of which vaccines to go for and should I vaccinate or not. To what extent do you, as a medical aid scheme, play a role in encouraging members to vaccinate, given, just the information that we know, particularly around what products are currently on the market?
Yeah, you see, there's a couple of issues here that I play. The first one is the issue around the vaccines themselves. It's very important that we do away with misinformation. I mean, there's a number of vaccination, it goes back to 1970s, and these are some of the products that have been available in the market. Vaccines that are used to treat polio, your measles. So it's very important to be able to manage the misinformation, try and educate others in as much as possible, so that at least we do away with this misinformation. I think that will go a long way, because we do have a question on the survey where we are saying that if somebody that's very close to that, and then you've got an idea, or you do find out that they're vaccinated, would you also go and get vaccinated? So some of those questions that we have in the survey are very important in terms of the influence that people who are well off and know more about vaccines can have and can contribute in as far as doing away with misinformation as possible. So it's very important for those who know more about service to educate others. So at least that's one of the things that will come out as one of the key insights in this study.
Michael, a final question from me. Obviously, initially, we understand that you, as medical aid schemes, were in close conversation with government. Earlier in the week, President Cyril Ramaphosa mentioned that South Africa needs to find a way in which to just develop its own vaccines instead of going the world over trying to source these kind of vaccines. How close are you to those kinds of conversations that are currently happening in the country?
Yeah. So remember, CMS is the regulator of medical schemes. We don't necessarily play in that space. Our role is to play an oversight role with medical schemes. But currently, what we do have a working group with the medical schemes representatives, which is now the HFA and the Board of Healthcare Funders, as well as the other medical schemes that are not affiliated with those three industry bodies. So on an ongoing basis, we do sit down and deliberate on these issues. And some of the key proposals that develop from those structures then get communicated with the National Department of Health, so that at least we try and enhance as well as inform the process in as much as possible. But in as far as the development, as well as development of vaccines, CMS that's not really our role. Our role is just to play an oversight role within medical schemes, but we do engage with the National Department in as far as some of the proposals that can enhance the process is concerned.
Michael, thank you so much for your time with us this evening. Really appreciated. Michael Woolley there,